here from WestfordCAT, and I have with me Gail Johnson, who is Westford's Public Health Nurse, and she is going to be my guest today on Health Beat. How are you, Gail?
Good. Thanks, Patty, for inviting me here today.
I'm sure you're super busy. I hope you're staying safe.
I am doing the best I can. Thank you.
Yeah, you guys are doing a good job. Thank you for all you're doing out there. So today is September 23rd, and I saw on the Westford Board of Health, is it Westford Health Department's Facebook page. Yeah, we have 200 total cases so far in Westford. 190 have recovered, and there are 8 active cases right now. Correct?
I believe so.
Yeah, it's on your website, so I'm not steering you wrong.
No.
But so, can you explain what happens when someone tests positive here in town? What are the steps that you go through?
So there's a couple of things, not to get confusing, but if you're asymptomatic, I'll start with that for a second. If you have no symptoms at all, whatever drew you to go to the get COVID tested, it surprises so many people. It's usually people who do not know that they have it go, and it's usually pre-surgical, like if they're going to have a procedure done, a colonoscopy, they make you have a COVID test prior, or any kind of a procedure. And people have come back positive, surprisingly, and they had no idea. And that was just based off of a random test that the doctor needed them to have. But if you have symptoms that is COVID, related, you go get tested and you're positive. So what happens, and people have asked me this, what happens when you're positive? And to make a long story short, anytime you have a communicable disease, part of my job as a public health nurse is not just COVID, but it's any communicable disease. And there are over 97 communicable diseases that are reportable to the state of Massachusetts. And with that being said, that could be tuberculosis, that could be Ebola, measles, it could be pertussis. And when you have a communicable, the lab by law is they need to report that to the state. Now the state can't call 351 cities and towns in Massachusetts. So what happens is I share a database, all public health nurses share a database with the state, the Department of Public Health, the DPH, and we only see our towns, and it will pop into our database. And back to COVID, if you get tested and you are positive for COVID, it goes into the state's database. I then open that case up, and then I start my case investigation. If that's the only way that would work. So
that's an efficient system. I mean, that's efficient.
Actually, it really is.
Yeah.
Lab results go into the state lab. The lab epidemiologists then put it into the database, and then I open up the database within my community. Other public health nurses see their own community. With that being said, I then open the case and then start it. And then what that means, so if Patty, you were positive, I would then call you, a Westford resident, and I would go down the clinical signs and symptoms with you to solidify the diagnosis. And then after we're done with the when did you get symptoms, and then I work out the isolation period with you. The isolation period is 10 days minimum. Mm-hmm. And what that means, that when I say minimum, it's after 10 days with 24 hours of fever-free without any use of any medication to lower like Motrin and Tylenol, to lower the temperature, and mark an improvement of symptoms. Once you have completed that, if you are still symptomatic on day 10, then I'll call them and they'll say, I'm still sick. I still got a sore throat and a headache or a fever. And I'll say, okay, let's just put it off. Maybe we'll wait 12 days. Maybe we'll wait 14 days until you resolve, right? So it's a minimum of 10. Then after you've met your criteria, I lift your isolation. That means you have completed, your symptom resolution has been resolved, and you are free to go on day 11. Like 10 days of isolation, day 11, you're free and clear.
Do you suggest people get tested again after they're feeling better?
No. So it used to be, back in the day, back at the beginning when this all started, they did the state and the CDC said, let's do a test-based strategy and a symptom-based strategy. Okay. So based on symptoms, if you have resolution of symptoms, that was great. But there were a lot of companies, mostly healthcare and others, that said, well, you can't come back here unless you have a negative test result. Well, that was fine, except that people can remain positive up to 3 months from the onset of illness.
I did not know that. That's interesting.
3 months. They have done the data and they realized if you test anywhere from the onset of symptoms up to 3 months, you keep testing. Not everybody. Obviously, some people do convert to negative, and that's fine. But there are some that are persistent little buggers that end up being positive for literally those 90 days.
But they're not contagious during those 90 days?
So not to get completely, scientific, but the RNA in your nose is not shedding, and I'm not a scientist, so please do not, please, I'm a nurse, but I'm not a molecular scientist, but.
We don't expect you to be, that's okay, Gail.
Please, scientifically, but they check when they do the testing again, they believe, the CDC and the DPH do not believe that you are actively shedding the virus after your 10 days or your resolution of symptoms, but can still test and still shed. And that's why you're still showing up positive, but not active disease. And I know the DPH could say that so much better than I.
No, that's great information. I didn't know that. So let's talk a little bit about testing. There's antigen testing and PCR testing. Can you describe what each of those are and what are the differences between them?
So the gold standard that I hear in every DPH meeting, every single one of them, the DPH, the Department of Public Health, and the CDC love the PCR test. And basically what that is, it's a molecular test. It's the gold standard. It's the best test. Now, what's being offered now from many, many places is those antigen testing. And why is that? It's because they're quick and they're done very quickly. And unfortunately, it's less sensitive and they're less specific. So what that means is you could get an actual false negative or a false positive. And if you get those, you're not getting that accurate result. So you must follow the PCR testing followed by, after the antigen testing, because you aren't really going to get a specific or the most accurate result. So despite getting the antigen test, a PCR must be followed prior, right after that, within at least 2 days.
So do you suggest people ask when they go to a testing facility, is this an antigen or a PCR? And how much difference in a turnaround time is it between the two?
That is such a great question. And I have to say, to be very honest with you, there are some private companies that are doing testing and their turnaround time for results are much slower than others.
Okay.
And if it's too slow, what that means is we will miss the isolation and quarantine period significantly. If we're not getting the test results 5 to 7 days later, you're already finishing up isolation by day 10.
Right.
So at this point, or even later, so, it's 48 hours, 48 to 72 hours, I think is the better, test turnaround time. But if anything longer than that, it's very difficult.
Do you have any suggestions of local places in the area where people should get tested?
So when I have a conversation with people, people ask me that all the time, where should I go? And the truth of the matter is I actually refer them to the Mass Department of Public Health website, and there is a link there of all the places to be tested. And the reason why I tell them to go onto that website versus me giving them a whole list of names is because people can make choices on how far they want to drive, how soon they want it. There's some drive-throughs, there's some walk-ins, there's some schedules. And again, as I mentioned, if you are going somewhere and you want it quicker than others, so it's best to call, first of all, a place where you're willing to drive to. And second of all, to actually find out how much they're going to charge you. Some charge you and some do not charge you. They'll take your insurance. And again, that's whether you're symptomatic or a close contact. Some places will charge you if you're traveling, because that's not a sickness. That's just because you're traveling. So there's a little difference there.
I was just curious if there was anything else you would like to let Westford residents know about COVID-19.
So I just actually, since I touched upon isolation period of 10 days, there are many questions people ask about quarantine and why there's a difference between 10 days and 14 days. And I actually wanted to just touch upon that. Sure. 10 days is from onset of illness to 10, and then 10 days is what the CDC's requirements are, the minimum, right? And then if you have no symptoms and got tested and found out that you are positive, day 1 is the date of test. That's how
Gotcha.
We have to go. So 10 days from that day. Now, what if you were exposed to somebody with it, and now I call you, Patty, and you said, well, I have it, but my best friend, I had dinner with her last night. Then I'd say, okay, you give me all the list of your contacts, and I have to call them all. Mm-hmm. And if you gave me 14 people, I would have to call 14 people. And that could be 14 people that are not in, excuse me, my phone is ringing. 14 people that could live in all different places, and I still have to call them. Whether they're in Littleton, Acton, Groton, Boxborough, New Hampshire, whatever, I'm still reaching out to all of them and give them quarantine orders. And then I will share the case with the other public health nurses in their town.
So then the other public health nurse would have to reach out to one of the 14, find who they've been around, correct? And then it goes out again.
So 14 days is based off of the last day of exposure that you have with somebody. Mm-hmm. So the last day of exposure is day 0, then following day is day 1, and then 14 days afterwards. And the reason why it's 14 days versus 10, it's because it could take 14 days to develop symptoms.
Yeah, gotcha.
It can rear its ugly head after 14 days. And one other thing, and people ask this all the time, is, well, if I test during the 2 to 14 days, what's the the recommendation is to be tested if you're a close contact to somebody and they get a negative result. Can I get out of quarantine? And the answer is no. You stay in quarantine for those 14 days despite a negative test result.
I understand.
And that's because it can mean one of two things. One is that when you did the swab and it's negative, or number 2, then when they did the swab, it was negative, the viral load at the time of the test may not have been high enough to pick up the virus. So it could be negative for 2 reasons. One, it hasn't picked up the virus that's still brewing in your body, or it is negative. And since we don't know if you will stay negative throughout the 14 days, you need to stay in for 14 days. And the other good thing about the test is that it picks up any asymptomatic positive people that you didn't even know you had it.
Right.
So there's that's what we're picking up that too. So
if that isn't keeping you busy enough, Let's talk about the flu clinics in town.
Yeah, so right. So since I'm so not busy with COVID day in and day out and contact tracing and all that, I now am planning flu clinics. So right now, all I can say is I have three dates I can definitively tell you. October 8th is the Franco-American senior 65 and older flu clinic at the from 11:30 to 3:30, and I have it on the website for different times based on your last name so that we can avoid the big crowds. And then the other two, I'm going to attempt to drive-throughs. So we're using the water department on October 15th and October 22nd from 4 to 7 p.m. And I'm going to try and hope that we can run this smoothly. We haven't done a drive-through here in Westford, so.
Well, you're not allowed drive-throughs, so yeah.
Exactly. Exactly. You can't drive through McDonald's. I don't know. So this will be, I'm hoping, goes smooth, and it'll be great having everyone register online and so that no one's filling out insurance forms while they're sitting in the car.
Right.
So, and making sure that everyone has a copy of their insurance card or cards if they have like Medicare and Blue Cross or whatever they have. And just bring a short sleeve shirt. Make sure you're wearing a short sleeve shirt so we can get in and get out.
Yeah, good advice.
Those are the 3 dates. And then I'll try to figure out other, I'm not doing any more walk-ins because of COVID and that. So we're trying to avoid that for right now.
Okay, Gail, well, it sounds like you guys are on top of things. You've been very busy. And, again, we appreciate all that you guys are doing over there to keep the town safe.
Thank you so much. Thank you.
So let's check in again, in a month or so and see how everything's going. Unless something changes, you can always reach out. We're here.
Hey, great. Oh, one more thing I do a plug
Sure.
in for Westford Coalition for Nonviolence. I chair that committee, and Domestic Violence Awareness Month is October. And I just wanted people to be aware that we're going to be bringing out brochures or pamphlets around town. So if you see anything from the Westford Coalition for Nonviolence, that's just our committee. We're just trying to raise awareness for domestic violence. And keep in mind all of those victims in the last year that have passed. And just keep them in your hearts in memory during this very important month of awareness. So thank you for letting me.
No problem at all. Bravo. It's a great cause. Thanks for that as well.
Thank you.
Okay, be safe, Gail.
You too.
For WestfordCAT, I'm Patty Stalker.